The death was ruled natural. The physical findings were inconsistent with that determination. Postmortem examination revealed the presence of heroin in the deceased system, leading to a reclassification of cause and manner of death. Chapter: Case background. On September 14, 2023, at approximately 9:45 p.m., neighbors reported an unusual silence from apartment 7B in Brooklyn Heights. The tenant, who was known for loud gatherings late into the night, had been absent since noon that day. Upon entry by emergency responders, they found the deceased lying prone on the floor of a bedroom with no apparent signs of trauma or struggle. Initial observations led to the assumption of natural causes due to the lack of external injuries and the absence of foul play indicators. Chapter: Initial findings. Emergency medical personnel arrived at the scene and conducted preliminary assessments without identifying any immediate life-threatening conditions. The body was in a prone position with slight rigidity indicative of early rigor mortis, though not fully developed. Livor mortis was noted over the back and posterior aspects, consistent with post-mortem positioning. There were no visible signs of trauma or defensive wounds on the body surface. Given the absence of clear indicators for homicide or suicide, initial responders classified the manner of death as natural based on the lack of apparent external injuries. Chapter: Forensic investigation. The forensic investigation began immediately following the medical examiner's preliminary assessment and collection of evidence at the scene. Evidence collectors meticulously documented and secured all items within the apartment that could be relevant to the case, including personal belongings, medications, syringes, and any drug paraphernalia observed. They noted the presence of a small amount of white powder residue on a nearby spoon and a used syringe partially hidden under a bedsheet. Chapter: Forensic investigation. The laboratory analysis was comprehensive, focusing on toxicological screening for various substances and pathological examination of tissue samples to determine the cause of death accurately. Toxicology panels were run to detect commonly abused drugs, such as opioids, benzodiazepines, and stimulants. The specific test used to identify heroin involved gas chromatography mass spectrometry, GCMS, which is highly sensitive for detecting drug metabolites in various biological matrices including blood and urine samples. Chapter: Forensic investigation. The laboratory results confirmed the presence of heroin at a concentration of 120 ng/ml in the deceased's bloodstream, significantly above the threshold considered lethal. Pathological examination revealed no signs of physical trauma or defensive wounds, supporting the initial classification as natural death based on external observation alone. However, microscopic analysis of liver and brain tissue samples showed acute cellular changes indicative of opioid toxicity, including dilated blood vessels and edema in the central nervous system. Chapter: Forensic investigation. The timeline reconstruction was critical to understanding how heroin overdose could have occurred without clear evidence of external factors or signs of struggle. The absence of defensive wounds suggested a lack of immediate threat, indicating that the deceased likely experienced a sudden onset of respiratory depression due to excessive opioid intake. Rigor mortis development and lividity patterns supported an estimation of post-mortem interval, PMI, between 6-12 hours at time of death, aligning with reports from neighbors who last saw or heard from the deceased around noon. Chapter: Forensic investigation. Expert testimony regarding the forensic findings would emphasize the importance of comprehensive toxicological testing in cases initially assessed as natural deaths. The absence of external trauma and presence of heroin in lethal concentrations firmly established a drug-related cause of death rather than any other hypothesis considered during initial investigations. However, while the evidence was conclusive about the role of heroin, it did not entirely rule out potential contributing factors such as co-ingestion of other substances or underlying health conditions that could have exacerbated the toxic effects. Chapter: Resolution. The final determination reclassified the cause of death from natural to drug overdose due to heroin intoxication. The initial ruling had been based on insufficient evidence and a lack of awareness regarding the comprehensive nature of forensic testing capabilities. This case highlighted the necessity for thorough investigation, including detailed toxicological analysis beyond surface-level observations. Chapter Resolution. The central finding was established through rigorous toxicological and pathological examination, demonstrating how modern forensic techniques can uncover critical details overlooked in preliminary assessments. The case also underscored the importance of maintaining a high standard of evidence collection and interpretation to ensure accurate determination of cause and manner of death. This case demonstrates the significance of comprehensive forensic methodologies and evidentiary standards in establishing definitive conclusions about causes of death. The file remains open,